had a wonderful day. Thanks to all my viewers and subscribers and those that's been sharing my videos. Very much appreciated. In today's video, I'm going to be speaking about some of the basic and important medications or medicines that you will need on your farm as a livestock farmer, especially if you're raising cattle or sheep or goats. You know, these are some of the must-have medications that you must have. Not all of them, but most of them. You know, the essential stuff that you need. So I'm gonna go through step by step and try and explain as much as I can. I might not get everything right, but as you know, we're all learning together. So correct me if I'm wrong. You know, like I always say. This is a request by one of my subscribers. You know, asking me about what medicines and stuff that they need to start their goat farm. You know, very similar to sheep farming. So that's what I'm going to do. So we're going to start with multibendazole suspension 2.5%. It kills tapeworms, ringworms, liver fluke worms, and lots of other type of worms, but that's the main thing. You know, it can be used for goats and sheep. So if you're doing livestock or if you want to do sheep and goats, that's the wormers that we use, multibendazole 2.5% suspension. It works for us. We do it every 30 days, whether in the dry season or the rainy season, and that's what works for us. So you might want to give it a try, or you might want to do your own research to find out what medication suits you best. So that's the wormer. It's the multivitamin injection, you know, or B complex, vitamin B complex. This is like a complete one, contains vitamin A, vitamin D3, vitamin E, vitamin B12, vitamin C, lots of other things, other vitamins and minerals. So basically, if you've got animal with loss of appetite, you know, losing weight, not eating properly, feeling a bit weak, you can do a 3-day course or a 5-day course depending on the weight of the animal. You know, and 9 times out of 10, this brings the animal back to its best self. You know, get them eating right. You know, get them feeling good again. So that's the multivitamin injectable that we use for them. Also got a 3-in-1 sulfur water solution. This can be used for all livestock, you know, chicken, turkeys, goats, sheep, cattle, you know, all livestock. This can be used, and it's a lifesaver. It contains a lot of vitamins, it contains a lot of antibiotics, you know, all in one. And basically it's a 5-day solution, you know, depending on the amount of animals that you have, which will go with the amount of liter of water you're going to use. We use this for 5 days every month. So the first 5 days of the month, this is what we use to mix in your water, your drinking water. We use it for all the animals on the farm. We use it for the sheep, the cattle, we use it for the chickens, the turkeys, the ducks, the guinea fowls, the rabbits. This is used for all of them every month, first 5 days of the month. And it's called 3-in-1 sulfur drinking water solution. You can find that in any, you know, this is not a promo for any shop, by the way. It's just me telling you what we do here and what works for us. Now we're gonna go to sulfonal. A lot of people will know sulfonal. So sulfur injection, and it's mainly used to treat diarrhea in livestock, whether it's sheep, goats or cattle. You know, you do a 2 or 3-day course, again depending on the weight, depending on the severity of the diarrhea, and 9 times out of 10 it stops the diarrhea, gets the job done. You know, and that's sulfonal. There's different types of sulfur medication that you can use, but this is the one that we use. It's called sulfonal. Going on the antibiotics, this is ivermectin. You know, ivermectin 1%. Antibiotics. It can be used to control external parasites as well. It can be used to control ticks and fleas and flies, but it's also antibiotics for infections. You know, so we use that. It's not the main antibiotics that we use, but every now and then we like to switch it up so that the animals or the bacteria doesn't adapt to the same antibiotics that we use over and over again. So it's one of the antibiotics that we have. It's very good. You know, when we used it in the past, it's very good. It's worked for us, and it's worked for a lot of other people as well. So it's ivermectin injection 1% by Ivano. You know, you can find that in a lot of agro shops in Ghana. So that's what we use. That's what it looks like in a bottle. Next on the list is oxytetracycline. You know, again, it's another antibiotics that we use. It's the main one that we use basically, you know, for respiratory infections, for viral diseases, a lot of infections. Oxytetracycline gets the job done, you know, and that's what we use. Oxytetracycline 10%. Again, the dosage depends on the weight of the animal. It's either a 2 or 3 day course, and it works for us, you know. So it's one of the antibiotics that we use. Oxytetracycline by tetranol 10%. Next one is tylosin. You know, tylosin, a lot of cattle farmers are familiar with that, you know, with a lot of, I think it's heart water disease in the cattle that they use. Sheep, we use to treat coughs, you know, again, respiratory. There's different types of respiratory diseases and infections. But mainly when we find out there's a sheep that's got a cough and that's coughing, 9 times out of 10, tylosin gets the job done. You know, you do a 2 day course depending on the weight of the animal, and it gets the job done. So tylosin by Tylenol 20%, again, depending on the weight of the animal. So make sure that you read the directions and the descriptions very much, and do your own research, you know, before you use any of these medications. Don't just get up and go and use it without not knowing how to use it. This is oxytocin 10. And it's one of the most very important drugs that we have, medications that we have on the farm. So if you find out you got a cattle, a sheep or goat that's in labor, that's struggling to give birth, or it's not producing milk, you administer this oxytocin depending on the weight of the animal, you know. And again, 9 times out of 10, when you inject this, if the animal is struggling to give birth, she's going to push the baby out with ease. If the animal is not lactating or producing enough milk, after administering this, they start producing milk. So oxytocin, very important as a livestock farmer. It's a must-have on your farm. And we've got pen strip 20%, 20 to 25. Again, one of the most important broad spectrum antibiotics that we have on the farm. You know, like I said, there's different types of antibiotics to treat different types of infections. So pen strip again is one of the most important must-have on your farm. You know, when we had an issue with sheep pox a few years back, you know, pen strip was the lifesaver, but back then we didn't know, you know, but now we know. So I'm advising you, pen strip, respiratory infections, contagious diseases especially, it gets the job done. You know, pen strip 20-25%, Mitranol 20%, and this is what we use to spray our animals every month, you know, to control external parasites. Amitranol 20%. We use that depending on the amount of liters of water you have. We dilute it and we use this to spray them every month to control external parasites. So Amitranol 20%. And last, oxytetravet. You know, I'm sure everyone knows this aerosol spray, antibiotics for wounds, you know, for cuts and things like that. It's a must-have on your farm. You know, it stops to keep the flies away, stops the wounds from getting infection, and it gets the job done. So oxytetravet aerosol, another must-have on the farm. You know, so all these medications that I've mentioned, I'm not advertising for anyone. I'm not telling you to go and use them. I'm telling you on what we use for us and what works for us. You know, do your own research, find out what works for your animals, find out what works best for your region, and most importantly, find out what you can get in your region. You know, and then, because you don't want to get something else and then it works for you, and then the following month or week you can't get hold of it anymore. There's a lot more vaccinations and there's a lot more medications that we use that obviously I can't get everything in the video. You know, we've got the salt lick, we've got molasses that we use as well, we've got the sheeppox vaccinations that we do, we've got the PPR vaccinations that we do. There's loads of other medications that I can't get everything in the video, but this is some of the main things, the main basic medications that you can get yourself as a farmer or as a manager, as the owner of the farm. Make sure that your workers got these stuff. Make sure your workers know how to use them. Make sure your workers know how to spot the signs of diseases, you know, so that it can be treated and controlled early, you know, instead of leaving it too late and then the animal passes away and you're losing investment, you're losing money. So thanks for watching the video. I hope you have a wonderful day, and don't forget to share, subscribe, like the video, and appreciate all the views and the comments. Thanks once again.